Hello.
Hello.
My name is Nicole.
Hi.
I'll be your nurse today. I'm going to just wash my hands and then we'll begin. It's nice to meet you, Mr. Matt. How are you feeling today?
Pretty good.
Good. So today we're going to evaluate your neurologic system. I'm going to begin by asking you some questions. The first question, are you around any occupational hazards?
No.
Do you have a history of using alcohol or recreational drugs?
I might have a beer or two every month.
Okay. Any hereditary disorders that you know of?
No.
Any history of chronic illnesses such as brain infections?
No.
Diabetes?
No.
Thyroid issues?
No.
Hypertension?
Yeah.
Any others?
No.
Okay. Over the past 2 weeks, have you felt down or depressed?
No.
Have you felt little interest or pleasure in doing things?
No.
Any history of seizures or convulsions?
No.
Are you having any pain?
No.
Any history of vertigo or dizziness?
No.
Any weakness lately?
No.
Are you having numbness now, or have you ever had numbness or paralysis in the past?
Yes.
In the past or now?
In the past I have.
Okay. Tell me about that.
Well, in 2007 I was diagnosed with Bell's palsy.
Okay.
I had some taste bud sensation loss and some droopiness on the left side.
On the left side. Okay. You said it lasted about 2 weeks?
About 2 weeks.
And you saw a doctor for this?
I did.
And what did he give you?
Some medicine to take and some facial exercises.
Okay, very good. Have you had any problems lately with balance or sensation?
No.
Coordination?
No.
Facial functions?
No.
Swallowing?
No.
Hearing?
No.
Smell or vision?
No.
Your speech?
No.
Shrugging shoulders?
No.
How about chewing or moving your tongue?
No.
How about turning your head?
No.
Very good. Just a couple more questions. Now I'm going to test the patient's mental status and cognitive abilities. Please tell me who you are and where you are at right now.
My name is Matt, and I'm at the clinic.
Okay, what day is it and what are we doing?
Today's Saturday, and I'm being examined.
Very good. Please repeat these numbers to me. 489-256.
489-256.
Okay. What are your plans for the future?
Well, to take care of my wife and 2 kids, and I plan on continuing my education in the future and trying to get my master's.
Okay, very good. So patient is meeting social and family obligations and he has appropriate future plans. I'm just going to give you a hypothetical situation or two. If you found a stamped envelope, what would you do with it?
Put it in the mailbox.
Okay. If a police officer turns on his lights and siren, what would you do?
Pull over and see what he needs.
Okay. And the patient responds appropriately to hypothetical situations. His speech is fluent and articulate with clear expression of thoughts. Okay, now we're going to start the physical part of our exam. I want to start off with cranial nerve evaluation 1 through 12. And so this first one is cranial nerve number 1, the olfactory nerve. And what I'm going to have you do, if you don't mind, is close your eyes. I want you to close one nostril. I'm going to give you a couple different things to smell, and I just want you to tell me, while keeping your eyes closed, what it smells like. Go ahead and smell.
That's coffee.
Okay, close the other nostril and keep your eyes closed. What does it smell like?
Coffee.
Very good. Keep your eyes closed. I'm going to give you one more. Close one nostril, please. Okay, and smell.
Oranges.
Okay, close the other nostril. And smell.
Oranges.
Very good. You can open your eyes. Okay. Patient able to identify familiar odors such as coffee and oranges, one nostril at a time with his eyes closed. Now I'm going to check your cranial nerve number 2, the optic nerve. I just want to ask you, can you tell me what color this is that I'm wearing?
Blue.
Okay, and what color is my chart?
Red.
Excellent. Now I want you to stand up, and I'm going to have you look at my Snellen chart. Stand right there. My Snellen chart is over here. I want you to close your right, cover your right eye. And read the smallest line possible.
E-F-P-T-O-Z, E-F-P-T-O-Z.
Okay, cover your other eye and read the line again, please.
E-F-P-T-O-Z, E-F-P-T-O-Z.
Okay, you can have a seat. Very good, 20/20 vision. Now I want you to take this card, cover one eye, please, and read the smallest line possible from 30 centimeters away.
E-F-P-T-O-Z-P-E-F-E.
Okay, cover the other eye for 30 centimeters away, and please read the smallest line possible.
E-F-P-T-O-Z-P-E-F-E.
Okay, very good. All right, now I'm going to check your peripheral vision by doing the confrontation test. I want you to close one eye, cover one eye, excuse me, and as soon as you see, look straight ahead, and as soon as you see my fingers in your peripheral vision, I want you to say now.
No. No. No.
Very good. All right, cover the other eye.
No. No. No.
Excellent. Thank you. Good peripheral vision. Okay, now we're going to check cranial nerve number 3, 4, and 6, the oculomotor, trochlear, and abducens nerves. I'm going to have you follow the 6 cardinal fields of gaze to evaluate eye movement. So what I want you to do is just look straight at me right now. Okay, now look at my finger and follow it only with your eyes. Do not turn your head. Okay. Very good. Okay, and now I'm going to check his pupils. They should be equal for size, shape, and reactive to light and accommodation. First, though, I do want to check for drooping eyelids and ptosis, and I do not see it. I do not see any drooping of eyelids. I'm going to dim the lights now, and I just want to check your pupils to see if they constrict. Look kind of straight ahead towards me. I'm going to shine a bright light in your eyes, okay? Good. Good. Pupils constrict. They are equal in size and shape. I want you to focus on a distant object for me. And when I tell you when, I want you to focus on my flashlight here. Okay, but not now. Focus out there. Now focus on this. Okay, good. His pupils constrict, and they are equal when they constrict. So he is reactive to light and accommodation. Now we're going to do our test for cranial nerve number 5, the trigeminal nerve. I want to check motor function, muscle tone, to see if his muscle tone and strength is symmetrical. And I'm also going to test sensory discrimination and the corneal blink reflex. So first what I want you to do is kind of sit forward a little bit for me. I want you to kind of clench your teeth for me, and I'm going to feel your muscles in your face. Clench. Very good. Okay. Strength of the muscles is equal. Now I'm going to test for superficial pain and touch sensation in the 3 divisions of the scalp, cheek, and chin with a tongue blade and a swab. You should feel the same on each side. Okay? Okay, you're able to feel that, correct?
Mm-hmm.
Does that feel the same or different?
Same.
Okay. The same or different? And you can just...
Same.
Very good. Okay. I want you to look up and away. I'm going to come at you and make you blink. Okay, the patient blinks symmetrically with the corneal blink reflex. And now I'm going to check cranial nerve number 7, the facial nerve, and I'm checking for facial motor functions. So I want you to please raise your eyebrows and wrinkle your forehead. Good. I want you to close your eyes tight. Good. Can you puff out your cheeks? You can open your eyes. Can you smile and do not show your teeth? Okay. Show your teeth. Good. Can you purse your lips like you're going to whistle? Very good. All right. Now I need you to say these words. Ball, mat, and page.
Ball, mat, and page.
Very good. He's able to enunciate labial sounds B, M, and P. No muscle weakness is noted, and the patient now should be able to identify different tastes as we move on to test cranial nerve number 7 and cranial nerve number 9. So I have 4 different solutions. Okay, I have a glass of water, and what I'm going to do is I'm going to give you different sensations on your tongue, whether it's salty, sweet, bitter, or sour, and I'm going to have you taste it and tell me if you taste this, or which one you taste on your tongue. Okay, so let's do the first set, which is for cranial nerve number 7. So go ahead and stick your tongue all the way out for me as far as you can go. Okay, I'm going to pull it all. You put it in your mouth and taste it.
Salt.
Let's try that one again. Okay. Let's do this one. Alright. Alright, stick your tongue all the way out.
Oh, that's sweet.
Okay. Let's move on to this one. Go ahead and take a sip of water. Okay, stick your tongue all the way out.
Salt.
Very good. Okay. Moving on to different solutions. Okay. Stick your tongue all the way out, and this is for cranial nerve number 9.
That's sour.
Okay. Go ahead and take a sip. Good. Stick your tongue all the way out. All the way out as far as you can.
Bitter.
Okay, thanks. Okay. And I want to perform the taste test on the other side of the tongue as well. And the patient will be able to identify the taste bilaterally on the tongue surface with all 4 solutions. And this does test for cranial nerve number 7 and cranial nerve number 9. All right, we're going to move on to cranial nerve number 8, the acoustic nerve. We've already examined the acoustic nerve in a previous evaluation, but I am going to do the whisper voice test in this one. So I'm going to whisper some words in your ear, and I want you to repeat them back to me, okay? Can you sit forward, please, a little bit for me?
My yellow duck is really quite funny. My blue duck is really quite silly.
Very good. And in the previous evaluation or examination, the patient did pass the Weber test. When the fork was applied midline, he was able to hear the sounds equally. In the Renee test, the patient was able to hear air conduction longer than bone conduction. And we've already tested for cranial nerve number 9, the glossopharyngeal nerve, and he was able to identify the taste on the posterior third of his tongue. And now we're going to move on to cranial nerve number 10, the vagus nerve. I'm going to check to see if his palate and uvula is symmetrical with speech sounds. So I want you to say, stick your tongue out and say ah. Tongue out, ah. Very good. The uvula is midline, no drooping or absence of the arch on the soft palate. And we're going to check the gag reflex. Okay, very good. And now I want you to swallow some water, and I want to see how easily he swallows water, if there's any coughing. Goes down okay? Mm-hmm. Okay. So there's no coughing, there is no hoarseness to his speech. And we're going to move on to cranial nerve number 11, which is the spinal accessory nerve. I'm going to be checking his trapezius and sternocleidomastoid muscles. They should be bilaterally symmetric in muscle strength, size, and shape. So I want you to sit forward for me, okay? I want you to shrug your shoulders and hold them up there, okay, while I press down. Very good. Okay, relax your shoulders. Now I want you to put your, bend your head forward and like you're touching your chin to your chest, and I'm going to push against, okay? Good. I want you to tilt your head back and push against my hand. Good. I want you to look to the right. Okay, I'm going to push against your hand. Look to the left, and I'm going to push against your hand. Okay. I want you to put your chin to your left shoulder. Push. Good. And I want your chin to the right shoulder. Very good. His muscles appear equal to size, strength, and shape. They are bilaterally symmetrical. And now I want to move on to cranial nerve number 12, the hypoglossal nerve. And now I'm going to inspect his tongue. There should be no tremors, no atrophy, and no deviation from the midline. So I want you to just open your mouth wide. I want you to put your tongue and rest it on the bottom of your mouth. Just the bottom of your mouth. Very good. Okay, stick your tongue out and move it side to side. Okay. Can you kind of curl your tongue up and try to touch your nose? Good. Can you curl your tongue down and try to touch your chin? Excellent. Can you put your tongue and push it against your cheek and the inside of your mouth? And I'm going to push against. Good. Very good. All right. I see no deviations from the midline and no tremors and no atrophy. And now I want you to test his lingual speech sounds. So I want you to say the words laugh, tail, dinner, and nice.
Laugh, tail, dinner, and nice.
Very good. No problems there. Now I'm going to check proprioception and cerebellar function assessment by checking his coordination and fine motor skills. So what I'm going to do is have you do what's called the rapid rhythmic alternating movements test. So I'm going to have you pat your knees with your hands like this and just kind of do it at the same time. So go ahead and do that for me. Slightly a little bit faster. A little faster. Very good. Now I just want you to do the finger touch. So I want you to touch your fingers to your thumb at the same time with both hands. Begin. Okay, very good. Now I'm going to check the accuracy of movements. I want you to, first I'm going to have you touch your nose, and then I'm going to have you touch my finger, okay? So go ahead and then come back to your nose. So touch your nose, touch my finger, go back to your nose, touch my finger. Very good. Okay, and now what I want you to do is you're going to hold your arms out like this, and I'm going to have you close your eyes, and I want you to touch your index finger to your nose on one arm at a time, bending your arm. So go ahead. Okay, very good. You can stop. And now I would like you to take the heel of one foot, and I'm going to have you slide it down the shin of your other leg, all the way down your foot and then all the way back up. Okay, so go ahead and pick whichever one you want. Good. Stays right in midline. Switch, please. Very good. Thank you. And now I'm going to check for equilibrium. So I'm going to have you stand and do what's called the Romberg test. First, I just want you to stand with your feet together. Okay. All right, come stand actually right over here for me. Right there. Okay, so just stand there for a second with your eyes open. Okay, now go ahead and close your eyes. There may be some swaying, and that is okay. I'm just going to push in your shoulder a little bit. Good. Very good. Are you able to keep your eyes closed and stand on one foot for 5 seconds? 1, 2, 3, 4, 5. Good. Switch. 1, 2, 3, 4, 5. Are you able to hop on one foot for about 4 or 5 seconds? 1, 2, 3, 4, 5. All right. Other foot, please. 1, 2, 3, 4, 5. Excellent. Okay, you can open your eyes. Thank you. Now I would like to check your gait to see how you walk. So if you can start back there. And I just want you to walk normally, relaxed, down and back a couple times. So just walk. Very good. Gait looks smooth. Go ahead and walk. And come back. Okay, thank you. Have a seat. His gait is smooth, regular, and the rhythm is symmetrical. The stride length is symmetrical. His trunk posture sways with the gait phase, and the arm swing is smooth and symmetrical. All right, very good. Now we're going to check your sensory function. We're going to do the sensory function evaluation. First, I'm going to check the primary sensory functions. What I want you to do is compare the perceived sensations side to side, okay? So I'm going to go ahead and have you close your eyes, okay? All right, and I want you to tell me which area that I'm touching on your body, okay?
Cheek, forehead, nose, cheek, forehead, shoulder, forearm.
Very good. Next, we're going to do the superficial superficial pain sensation. So I'm going to touch you with a sharp and dull edge of a tongue blade. I want you to identify if it is dull or sharp in the area of location. Okay?
Mm-hmm. Dull, and it's in my shoulder.
Very good.
Sharp, shoulder.
Which one?
Right shoulder.
Very good. Relax your arms.
Sharp, right forearm.
Okay.
Sharp, left cheek. Dull, right forehead.
Okay.
Sharp, left forehead.
Very good. If the superficial pain sensation was not intact or not felt, then we would move on to the test temperature sensation by rolling hot and cold test tubes on the skin, and the patient would be able to identify if it was hot or cold in the area of location. But since he did okay with the superficial pain sensation, we do not have to move on to that test. Now I'm going to test the joint position sensation. I'm going to have you close your eyes again. Okay, and I want you to tell me if I'm moving your finger up or down.
Up, down.
Good. Spread your hand out. Okay.
Down, up.
Very good. Okay. Patient able to correctly identify the movement of the joint test. Now I'm going to check cortical sensory function. I'm going to have you close your eyes again, and first is the stereognosis test. The patient should be able to identify the objects that are placed in his hand. All right, hold your hand out, keep your eyes closed, and I just want you to feel with this hand and tell me what you're feeling.
A key.
Good, keep your eyes closed.
A paper clip.
Good, keep your eyes closed, and one more.
A coin.
Okay, how about this hand?
Paper clip.
Very good. Okay, now I'm going to do what's called a 2-point discrimination test. Let me know when you no longer distinguish the two, keep your eyes closed, the 2 points. So let me know when it feels like it's gone down to, instead of 2 different spots, when it goes down to 1 point, okay?
Mm-hmm.
So,
2.
so say, yeah, I'm sorry, say 2 when it still feels like there's 2 points, and then say 1 when you feel 1.
Okay. 2, 2, 2, 1.
Okay, let's do the other arm.
2, 2, 2, 1.
Okay, the patient measures about 6 millimeters when he no longer distinguishes the 2 points. Okay, now I'm going to do what's called the extinction phenomenon. The patient should feel similar sensations bilaterally. Okay. Alright, keep your eyes closed, and I want you to see, see if this feels the same. Or tell me if it's different. Same or different?
Same.
Okay.
Same. Same. Same.
Very good. Okay. And I'm going to do the graphesthesia. The patient should be able to recognize the number or letter that I trace on his palm. Keep your eyes closed. I'm going to trace a number or letter on your palm. Let me know what you think it is, okay?
8.
Very good.
D.
Excellent. Patient's able to recognize the number and the letter. And now I'm going to do what's called point location. I'm going to touch different areas of the body, and I want you to point to the area that I touched, okay? Point to the area that I touched. Very good. Okay, we are almost done. This last part, and we're going to open your eyes. We're going to check your reflexes. So first I'm going to check the superficial reflexes. I'm going to check for plantar flexion of his toes on both feet while doing the plantar reflex. So I'm going to, if you can give me your foot, okay, this may tickle. Okay, patient flexes all his toes. Let's look at this. Patient flexes all his toes. Sorry if you're a little ticklish. Okay, now I'm going to check the deep tendon reflexes. First I'm going to start with the biflex reflex. There should be visible flexion of the elbow. So what I'm going to have you do is just relax your arm as much as possible, but hold it right here if you don't mind. Okay. I'm feeling for the tendon. Okay. Very good. Okay. Very good. Visible flexion of the elbow is noted. Now I'm going to check the brachioradial reflex. Okay. Very good. And now I want to check the triceps reflex. There should be visible extension of the elbow. Okay, try to relax your arm. I'm feeling for the deep tendon. Okay. Are you okay?
Yep.
Okay. Very good. And now I'm going to check the patellar reflex. Go ahead and scoot back as much as you can in the chair. Okay, relax. And while I'm doing this, if you can kind of hold your arms like that and try to like squeeze your arms apart, and that kind of takes the focus off what I'm doing down here. Okay. Very good. Should be slightly beneath the patella, excuse me. Very good. All right, you can relax. Thank you. And one more test, I'm just checking for ankle clonus. This test is especially good for if the reflexes are hyperactive. So I'm checking to see if any clonus is noted. Nothing on the right. Very good. And nothing on the left. Excellent. Okay, that concludes the physical exam part. Some education I would give you would just be regarding staying well and stroke prevention. What I would recommend, and I'm going to give you some handouts, is some pamphlets and information on prevention of stroke. And that includes healthy eating, a diet that is low in fat, low in sodium, increasing your fruits and vegetables, watching your cholesterol, getting exercise, at least 30 minutes of aerobic exercise every day. Perhaps even decreasing your weight can help with prevention of stroke. I also think it's great that you're monitoring your blood pressure. I advise you to continue to do that. I would probably keep a piece of paper in your wallet and just record every time you go to Publix and you use their blood pressure machine. Do you have a blood pressure cuff at home that you use or monitor?
Yes.
Okay. I would do that, and write the date and time, what you were doing, if you were sitting down, if you just got done mowing the yard, and I would record that, and then when you come back or when you visit your primary care provider, you can provide that to him. So,
okay.
Do you have any questions or concerns or something you wanted to add or hit on or discuss?
No, thanks.
Okay, so I'll get that information to you. It was very nice to meet you.
Okay,
Hope you have a good day. Thank you.
All right, thanks.